morning. My name's Robyn Littleford, and I teach at GF Strong School Program at GF Strong Rehab Center. And I'm talking to you this morning about returning to school following a moderate or severe brain injury. Well, I'd like to start by just reviewing some of the physical outcomes of brain injury. They can include things like fatigue, sleep issues, chronic pain, light and sound sensitivity, issues with vision and hearing, and then physical deficits. Other possible outcomes cognitively would include things like lack of insight, impulsivity, difficulty initiating, slowed processing, difficulties with planning and organization, and difficulties with multitasking and sequencing. And we're going to continue this list. So poor memory, difficulty with judgment and decision-making, reasoning, problem-solving, distractibility and confusion, difficulty dealing with change, maybe inflexible thinking, and issues with language. Emotionally, you may see issues around mood disorders, changing emotions that change quite quickly, or a flat affect, behavioral outbursts, personality change, and socially inappropriate behavior. The reason I started with that list is because I want you to understand how complex brain injury actually is. And there's a lot of things to consider when students actually are returning to school. Okay, the other thing I need you to think about is that in BC, we have a big province and we have over 1,700 different schools. So there's many different ways of returning a student to school. And every district is going to have its own set of issues, and they'll also have different resources. So in the classroom, it's really important to consider what a student actually has to do in a classroom. Classrooms are very complex places. So a student has to listen, they have to pay attention, they have to ignore distractions and concentrate, they may have to take notes. They're expected to learn new information. They also have to remember the old information that they've learned. And so they have to then use the old and the new information to actually store new thoughts and do some creative problem solving. They also may have to record their homework and their agendas, remember the class rules, and be kind, caring, and considerate to their friends. So the hallway, that's another place you need to consider. Hallways are very, very distracting places. So students are expected to negotiate a sea of other students. They have to avoid legs and lunch bags, and they have to know the quickest way to their classes. They have to know where their locker is from any given direction. They need to know what their locker number is and maybe their combination. So they also need to know where maybe up to 8 classrooms are. In an elementary school, that would be different. But in high school, it's a pretty complex environment. And they'd also have to know how to get to the gym, the library, and the counseling offices. So in terms of returning a student to school, this is what I would do when I'm returning a student from a rehab center back to school. It's really important to contact a school as soon as the injury occurs and start the planning process early. And the school district needs to know as well. I personally write a letter, but I think a phone call from a parent or from another support providers would suffice as well. You need to identify a school-based case coordinator, and you need to have the school team identified that you'll be working with. A really important part of this process is around funding, because if a student didn't have a designated funding prior to their injury, they will likely have it afterwards, and that's a process, and that takes a while. So staying in touch with the school team is really important, and having preliminary discussions around a gradual school return is also important. Now, when a student comes home from a hospital or from a rehab center, sometimes a student needs to stay at home for a while. And so some districts actually have hospital homebound instructors available, and that would be a wonderful way to actually start the school return process, because that hospital homebound teacher is actually going to learn how that student actually learns. And then the next step would be to organize a school visit for the student. That's a really important process because that's a very emotional moment for a student when they step back into a school for the very first time. And often there's a very emotional reaction on the other side from the students' peers. And so doing that outside of the context of going to class is actually a really good idea. So one of the things, if the student has actually been in a rehab center or in a hospital, having access to those summary reports from therapists is really important. Those reports contain very valuable information. The next step would be to have an educational in-service for teachers, and if the peer actually agrees to it, it can be really helpful to have an in-service for friends. But especially for adolescents, you need to have their permission. There's nothing worse than having a team of professionals coming in to meet with your friends when you don't want that to happen. Now, the next step would be to identify an interim individual education plan. We call these IEPs for short. So in terms of funding categories, students with traumatic brain injury typically would be included in a group that it's a level called chronic health impairment physical disability. That would be the most common funding category. It's what we call low incidence, and because there's not that many students in this category. And this category does provide funding, but you have to remember that funding is not student specific. And so the category is really important because it does generate funding. But we want the support. We want the student to have an IEP. We want them to have support in their classes, and we want them to have access to learning support. And really important dates in this province are September and February for this, for the application process for this funding. Now, the IEP is a really important document to have in place. It summarizes the student's education plan, and it's a tool to monitor and communicate around a student's growth. It will record a student's strengths and weaknesses, and it's a flexible working document. And it's an ongoing record of how the student has progressed through school. So an IEP has document weaknesses and strengths, as I've mentioned previously, but it also, more importantly, identifies the academic and behavioral and social goals for that student. And it's really important that teachers have access to this information. So it will actually document learning outcomes and identify a plan. So when we put students back to school, we have two terms that you'll run across. One is the term adapted, and one's the term modified. So for adapted programs, students actually are still working on the same curriculum as their peers, but the curriculum may be adapted. So this student will still be working towards a Dogwood certificate, and that means that they will graduate with their peers. Adaptations can include things like extra time, writing exams in an alternate setting, perhaps a reduced course load, so students might only be taking 6 instead of 8 courses. Note takers, having access to someone else's notes, being able to use a computer in class. Whereas modified is where the curriculum is actually different than a peer's curriculum, and that would be that student is actually not going to graduate with a Dogwood diploma. And you might see a student working. Perhaps they're in Math 10 and they're working on a life skills math program, whereas their peers might be doing the regular Math 10 curriculum. So in PE, you might see that students are doing PE 8, but a student might be working on a home exercise program with a special education assistant. So it's really important when kids go back to school to consider the kinds of academic support they need. What kind of structure do they need? What kind of supervision do they need? What kind of scheduling should happen throughout the day? Even how long should their day be? Their course load, their length of assignments, and test accommodations. There's lots of things to consider, practical issues to consider. And then we have learning needs. Does a student need an extra set of textbooks for home? Perhaps they need adaptive equipment, or they should have a referral to Special Education Technology, BC. What kind of instructional methods are going to be used? Do they need special materials and adaptive equipment? And what kind of strategies are actually going to be used with that student? They also might need testing modifications. And for lots of students with brain injury that process slowly, the work expectations actually need to be modified. Frequency of breaks is another issue to consider. There's also some really significant safety issues to consider. Some students actually, following a brain injury, need medication for seizures. So that's a really important safety plan that needs to be developed. And emergency procedures and routines, school safety routines need to be reviewed with students and their families. So there's also, I referred before to environmental needs. You need to look at where the lockers are located. Locker combinations have to be learned, location of classes, movement through hallways. And in rural BC, we need to consider bus scheduling. That's a really important issue to discuss. Even parking. Some students actually need specific parking. So communication needs is another issue or area that needs to be addressed. Home-school communication is absolutely essential when a student with brain injury returns to school. Staff education is another area of need. It's not okay to send a student with brain injury back to school without educating the school staff. And I also spoke about peer education as well. So school staff education can occur on many different levels, but really specifically we need to target teaching staff. Peer education is important, and family education as well. A lot of our students are actually moving from just the regular stream of school into the special ed stream of school, which is actually quite different. And the other thing we need to consider is that transitions are an important time to pay attention to, and all sorts of transitions, not just the transition from one grade to another, but we have transitions within a school day, transitions between activities and settings, between classes, going from PE class to math class. And then we also need to look at the elementary to secondary transition. And finally, we really need to pay attention to the actual transition from being in high school to adulthood, and that requires a lot of planning as well. Please remember that these transitions for kids with brain injury is really challenging. So they can be small transitions or they can be really significant transitions. So some tips. It's really important to include students in the process of returning to school following a brain injury as much as possible. Getting buy-in from students is important. The planning collaboratively and frequent communication is essential if these plans are actually going to work. And including parents in the process is critical. Parents know their kids best and they need to be part of this process. Using a diagnostic teaching approach is really important for teachers. Ensuring consistency of approach and structure is another thing to consider. Keeping routines and expectations realistic and consistent, and ensuring success for the student is a really critical aspect of school return planning. So these students really need to have their programs monitored and adapted and modified as necessary. So it's important to be flexible. So it's always important to be looking to the future and planning ahead. And please don't forget the friends. That's absolutely critical in terms of the school return piece. So you need to remember that really most teachers have very little experience with brain injury. It's not something that we run across a lot in our career. You also need to remember that time reveals issues. So this is a really critical issue to realize, or concept to understand, is that our brains develop over time. And so as issues are unraveling, they're going to show up in the curriculum. So that's an important thing to remember. So this is really quite a developmental issue. And just because a student appears fine on the outside doesn't mean that they're not struggling on the inside. It takes a long time for a brain injury to heal. So there's no definite time for recovery. So I think what's really important here to remember is that it's a long-term process, and it's important to be flexible. And please include parents in this entire planning process, because ultimately it's a parent that knows their children the best. They've been there before the injury, they've been through the injury with their child, and they're going to be there afterwards. So including parents in this planning process is very, very important. It's a complex, long-term planning process. There's lots of online resources available to you that are very, very useful in this planning process. And I hope that this webinar was helpful to you. Thank you.